Hello, I am Dr. Ngozi and welcome to my channel. Today I will the importance of heart health. So why is heart health important? So we are seeing a spike in heart disease deaths globally. In Philadelphia, this is also occurring, especially black and brown people are disproportionately affected. And the issue is that the heart disease deaths are occurring at the peak of a person's life. So about 50s to 60s. These are their peak productive years. And so it's impacting families as well as communities. So when you look at somebody who's coming from a disadvantaged background, maybe they didn't have access to going to schools early, and so they've reached the pinnacle of their earning years in their 50s, and then if they get sick, it does impact their earning potential as well as the future for the families. So this is a very important topic from the perspective of quality of life, longevity, and also from an economic perspective. Here in Philadelphia, we understand that the city is the top 10 poorest of the largest cities in America. So we cannot afford heart disease in the city. So what I'm going to talk to you today about is heart health and how we can raise awareness about heart health. So my name is Dr. Noha, as mentioned. I'm a primary care physician, trained internal medicine and geriatric double board certified. I also have an MBA in healthcare management, and I've taken many certification courses in health, global health, and lived in Philadelphia for over 20 years. So I currently have two programs that I'm running to raise heart health awareness to improve health outcomes. So let me talk a little bit about why this is so important, how we can actually prevent heart disease, what we can do to improve our health. Now, I have to say, this information here is provided just as health education. So I started my brand in 2016 just to provide health education content in the diaspora communities, in multicultural audiences, and in and around Philadelphia and globally. So content is produced on social media. So let's dive in. We sometimes hear someone has heart failure. What does this mean? It means they have a weakness in the heart pump. So the heart is weak, the muscles are weak. So that heart is not able to do its due diligence, its job of delivering oxygen to various organs. So what then happens is that those organs start to fall ill. So you may have congestive heart failure, and then you have somebody who now has kidney problems, liver problems, brain problems, and so many other things. So how does this start to happen? So for the most part, I'm going to just talk about heart disease here. It's actually called ischemic heart disease. So what is it? It's just a gradual blockage of the vessels of the heart. So I just want to let you know that in addition to pumping blood in and around the body, the heart also supplies itself. So can you just believe such a remarkable organ? Aside from helping the other organs, it also helps itself. So there are small vessels that also supply the heart. And those vessels are quite small, and those vessels can block off quite easily. So I'm going to show you a little model here. I got this off Amazon. So this is a little model that shows the progression of how the inside of the blood vessel starts to thicken up, eventually leading to what we call ischemic heart disease. So here I'm referring to that as heart disease, but it's actually called ischemic heart disease. So you have the buildup of plaque and fatty substances in the heart, and eventually it leads to blockages. So that is the main problem, these blockages. You can imagine having an organ where the blood vessel supply is being cut off. That organ cannot function properly, right? So what happens is over time, it's a buildup that, like I said, it's here we have a model of how vascular disease occurs. So this is how the vessel looks, and you see a buildup of fatty substances that eventually lead to blockages, and then you have a thickened clot that cannot get through, and then that causes what we see as heart attacks, strokes, kidney failure, vascular problems, vascular problems in the limbs that can lead to gangrene. So there are many factors and many things that we can actually change to change this trajectory of heart disease. So some of the things that we can do are things that are within our control. So let's talk about smoking. Smoking is one of the factors that causes this. So to reduce the risk of heart disease, the first thing is to seek resources to stop smoking. There are many resources out there to stop smoking. They include the patches, and they also include medications such as Wellbutrin and Chantix. Chantix was available previously, it was off the market, but now it's back. So there are medications that can help people to reduce smoking. Smoking is a huge cause of vascular disease. It's something in the nicotine that causes inflammation in the vessels. Aside from being a very potent cancer-causing agent, cigarettes contain over, hundreds of cancer-causing substances. So, but smoking is a big cause of heart disease, vascular disease, blocks arteries, and causes so many problems. So the first thing, if you smoke, you want to quit smoking. You really do. And if you talk to your primary care provider, they can give you options for what's available. Sometimes it's combination treatments with the patches and the pills, and it can take up to 7 different attempts to actually quit smoking. Nicotine is a very addictive substance. It's very hard for people to quit smoking. But when you know this is what smoking can cause, I can reassure you that you're going to stop smoking very soon. All right, so we talked about that. The second thing is lack of physical activity. If you do not exercise, your muscles will become flabby. So let's talk about exercise. Why is exercise so important? So, if you don't exercise, your muscles eventually become very weak. Do you remember how you felt after a few days of bed rest, where your legs become wobbly and your muscles are weak? Well, it's the same thing. If you don't exercise, your muscles become weak. And if you don't exercise, your heart muscle becomes weak. This means that your heart muscle cannot withstand periods of stress. So intermittently, we're going to have stress. Stress is a normal part of life. But if your heart is not resilient to that stress can cause spikes in blood pressure and other abnormal sensations in the heart. It can cause rapid heartbeats and lead to conditions such as arrhythmias, abnormal heartbeats. So if your heart is weak, it is what we call deconditioned. Your heart is deconditioned. And then if you are predisposed to a little stress, that stress can make your heart health worse. So exercise should be a normal phenomenon occurring every day. So exercise can be something as simple as walking every day for about 30 minutes. You can get 30 minutes of walking exercise. This is safe for your joints and you're less likely to injure as opposed to if you were running or doing any kind of other strenuous exercise activities. So try to incorporate walking into your daily routines. If you a nice brisk walk for 10 minutes 3 times a day or for 30 minutes will really go a long way to improving your heart health conditions. It's great for the blood pressure, it's great for reducing weight, and it's great for overall muscle function. So incorporate daily exercise into your routines, your daily routines. So this is important because what it does when you exercise, you actually reduce the amount of fat in your body. So then you have less fat depositing on the inside of your vessels. So this is the model of how heart disease can occur by blockages of the vessels, and then a clot comes through and just causes complete destruction. About something that I've termed know your health numbers. Okay, know your health numbers. So what do I mean by that? So there's certain measures that actually contribute to the blockages here that we're seeing here. So some of these things are elevations in blood glucose. Okay, so the way I kind of describe it is, imagine something that's sticky. So when you have sticky, like you have honey or sugar syrup, it's sticky. So things will stick to it. So likewise, when your blood sugar is elevated, it creates a sticky situation. So all kinds of things that are floating in the blood will now stick. So that is how I describe it. It's a sticky situation. So you want to know your numbers. So the A1C is a blood test, and the glucose. Those will identify whether or not you have a sticky situation. So do you have diabetes? Diabetes is a sticky situation. Or do you have pre-diabetes? Pre-diabetes is a sticky situation. So if you have any of these conditions, it could be because you're just eating a lot of sugar, refined sugar. So refined sugar that's coming in various foods, drinks that you're not aware of, alcohol. And so you want to make a shift from those sticky things to reduce stickiness in the blood, because we don't want this happening. So the advice on reducing stickiness is beyond the scope of this video. I would suggest that you contact a nutritionist and who can help you on your journey to being less sticky. We don't want to be sticky. So diabetes is a huge problem. It's a huge problem. You to reduce the amount of sugar, you have to know how to read food labels. So when you buy things in the store, check the label and look and see the quantity of sugar in there. As a rule, things that are sold for kids tend to have less sugar. So if you have concerns about certain foods that you're eating, maybe yogurts, and if you see that they have a ton of added sugar, and check the kids section, and you may find products that actually have less sugar in them. And eating fruits and vegetables as opposed to drinking sugary drinks will help you reduce the sticky situation that leads to all this here. All right, so I've discussed quite a number of good salient points here. First, I talked about smoking cessation, and then I talked about the role of exercise, and now I've talked about the sticky situation of excess sugar in the blood. So let's talk about the fatty situation of cholesterol. So We have bad cholesterol and we have good cholesterol. The bad cholesterol is a problem. It comes from the trans fats and the saturated fats. Some of these are added into food as preservatives, so they help to preserve the shelf life of foods. So you will find that foods that are typically on the shelves for a long time tend to have more of these trans fats because they help these foods stay longer on the shelf life, on the shelves. So we all know this because when you buy fruits and you keep them out, within 3 days those fruits are gone. They go off. So compare with packaged foods. Packaged foods that have been sitting on the shelf, you can keep them on the shelf for about 2 years and nothing will happen. And why is that? Because they have a lot of added preservatives. They have added salt. That added salt helps to keep that food on the shelf for much longer. So knowing how to read food labels is important, and choosing your foods properly is important. And that is where you also want to learn how to cook. If you don't know how to cook, you want to learn how to cook. And the reason for that is so you can choose what you're adding to your foods. So it needs a little bit of planning. It's beyond the scope of this video. It does need planning. You have to be strategic. When you start out the week, you have to plan your food, what you're going to eat, and maybe cook in bulk. Put the foods in the freezer or fridge for the week. That way you are eating healthier foods as opposed to grabbing fast foods that contain a lot of trans fats. Trans fats are bad for us. They cause these blockages that we see here. They sit in here and they cause these blockages. So I've talked about the smoking cessation, the exercise, reducing sugar, reducing the stickiness, and now reducing the fatty deposits through healthier eating and lifestyle. All right, so let's talk about high blood pressure. So the normal reading is about 120/80. So the top number is the systolic and the bottom number is the diastolic. So this is generally a good blood pressure reading, 120/80 for most people, for most adults. Now, what happens is that when the blood pressure goes up, for a number of reasons, there are a number of reasons people develop high blood pressure or hypertension, as it's called. There's most of the time it is genetic, but there are other conditions that contribute to elevations in blood pressure. Now, when the blood pressure is high, it's like having a high gauge pump. The heart has to work harder and it puts a lot of pressure on the heart. So when the blood pressure is elevated, you have the heart working excessively harder. It starts to get tired over time, and then sometimes to compensate for that fatigue, the heart will start to stretch. And if this stretch is not checked or treated, it can develop into what we call congestive heart failure. Congestive heart failure is when the heart is just weak. It becomes like a swollen bag and it becomes weak. So it cannot perform its usual duties of pumping blood. So high blood pressure will contribute to this problem of heart disease. When the blood pressure is so high, it causes weakness inside the blood vessels as well. And this weakness results in a buildup of these fatty substances, and also it can create a clot situation. And if that clot cannot get through the blockages, you have a heart attack type of situation, or you have chronic ischemia where that person is constantly having chest pain, or they're having other vascular problems, kidneys. These sort of things, when they happen in the kidneys, can lead to kidney problems, kidney failure, and vascular problems that can lead to loss of limb, so vascular disease. So as well as brain problems. So brain problems would include things like memory loss, dementia, from just not getting enough blood flow, as well as strokes. So blood pressure control is extremely important. For some people with high blood pressure, they need to be on medications. Not everyone can control their blood pressure just with lifestyle. It's just not enough. The reality is that as people get older, most of the time their blood pressure is going to go up because the vessels become stiff. So the vessels are stiff, they're not as pliable. So when that happens is they develop high blood pressure. A lot of those blood pressures, they just cannot be controlled with lifestyle. I know some people don't like to take medications because they worry about the various side effects, but there are many blood pressure medications that can be prescribed. If somebody has side effects with one, there are always alternative blood pressure medications. And many people cannot be controlled on just one blood pressure medication. They may need to be on 2 or more blood pressure medications. So controlling the blood pressure is of vital importance to heart health. There are many people who are walking around, they don't even know they have high blood pressure. And so when I talk about know your health numbers, it is a question of understanding that most people will develop high blood pressure as they get older, just because their blood vessels become stiffer. And it is important to know those numbers. At least have one checkup a year where you're getting your blood pressure checked and you're getting your blood tests checked. So what I call know your health numbers. And this is very important. So I've talked about the various factors that we can control to reduce the issue of heart disease. So I will recap. It's smoking cessation, it's exercise, it's reducing the stickiness, reducing the risk of diabetes, and reducing the risk of high cholesterol, which is coming from a number of things. High sugars also contribute to high cholesterol, as well as the consumption of processed and ultra-processed foods that contain trans fats and saturated fats, which are bad for us. All right, so I want to talk about yet another important modifiable condition. What do I mean by modifiable? Modifiable means that we can change it. And what is it? It is a matter of weight, obesity. Obesity is something that we can control just with simple measures of having a structured regime of exercise and ensuring that we have a balanced diet. Or shall I say balanced nutrition intake? A lot of people don't like the word diet, but obesity is a huge problem for heart disease because with the excess weight, the heart has to work harder. So this is the same heart you were born with, and if as an adult you have excess weight on you, your heart is pumping away, it is working harder. So the weight creates an extra burden, and that burden causes a bunch of things. Aside from the excess fat that deposits around the organs, it doesn't allow the organs to function properly. And if you have fat around the heart, it also impedes the function of the heart. It's simple mechanics, think about it. You have this heart that is the same heart that you've had since you were born. Now as an adult, you have a lot of weight on you, more than you should. So know your numbers. you can look at a calculation called the body mass index. And if you have a body mass index of over 30, it is considered obese. And if you have a body mass index of over 40, it is considered morbid obesity. So that already tells you a lot. So if you look at these factors, you know that you can control some of these things, right? The obesity is a mismatch of input versus output. So aside from input versus output, so input is what we are eating and drinking. And some people like to drink their calories, so they're drinking a lot of sugary drinks. Those drinks have hidden calories. Versus how we exercise. Aside from that, obesity is very complex. It's not just our food intake. It is also issues with stress. Stress as well as hormonal factors. When you have stress, your body is going to make cortisol. And cortisol is going to blow most people up. So over time, that cortisol is going to cause obesity. So obesity is a very complex interplay for people of factors that can cause an increase in weight. So checking those weights, the weight through adequate nutrition and the right type of exercise. So exercise is not just walking, it is also stretching, it is also lifting weights, light weights, 5-pound weights, 10-pound weights. So incorporating muscle strengthening, very important. It will help to reduce some of that excess weight. You want to get a personal trainer if you can afford it, or at least get assessed by a personal trainer when you visit the gym, and let them give you some kind of framework for how you're going to improve your physical activity to reduce the impact of obesity. So I've talked about many topics today. I'm going to talk about stress. I mentioned that earlier, stress as creating a risk for heart disease. And what stress does, it does many things actually. Stress is, shall I say, a normal part of life, but how we respond to stress can make us ill. So learning to rest is important. Getting adequate sleep is extremely important. And self-care, so understanding what your boundaries are for stress, and also seeking maybe a mental health therapist to help you on your stress journey. So stress can make people sick. Stress can produce a ton of toxic hormones. We can produce toxic hormones that can contribute to illness. And aside from that, stress can cause elevations of blood pressure. So self-care important, attention to reducing stress, techniques for reducing stress, techniques for mindfulness. So things like prayer, meditation, exercise, talking to a therapist or a counselor. And there are lots of resources available for you for mental health support. So there are many resources available for that. And I think we have come to the end of this presentation where I have discussed conditions that contribute to heart disease rates. We are having a global problem with heart disease. This is really a huge problem, and most of it has been driven, I think, by westernization because of our lifestyles. We're spending more time in traffic, we're spending more time commuting, and also our dietary habits, the kind of foods now available to us, the availability of food. We have a lot of processed foods that are readily available to us, and it takes a lot of effort to actually eat healthy. It takes a lot of effort to eat fruits and vegetables. Some of these fruits and vegetables are not readily accessible, especially in areas that are food deserts. So it needs a little more planning for how to eat healthy so that we can actually reduce the risk of heart disease that we are seeing in the various communities, actually globally. For listening. If you found this helpful, please share with your friends, and have a wonderful day, and bye for now.